Siddha is actually it's an ancient medical system that is practiced in the southern part of India, whereas the Ayurveda is more popular in the northern part of India. The medical practice of the ancient Tamil civilization. Yes, in the Ayush, it actually represents Siddha system of medicine. The Siddha system was developed by 18 Siddhas. The Siddhas, this term actually includes the experts in medicine. They are also the experts in other lifestyle practices too. So, and moreover, there are a lot of similarities between Siddha and Ayurveda, as in both believes in 5 elements and the 3 humor concepts and the 7 tissue concepts and also the 3 bodies doctrine. The ancient chemistry, it has a very strong background within it, and that is the main reason for the development of the modern chemistry now. Actually, I'm basically a Siddha practitioner, and I am also a expert in genetics and molecular biology. Thing which I'm going to present now is to just give you a basic idea about what kind of chemistry that has been involved in the ancient traditional system, that is the Siddha medical system. Actually, most of the people over here are much aware of the term Ayurveda, Ayurvedic system of medicine. But I don't think most of the people are aware of the term Siddha. Siddha is actually a it's an ancient medical system that is practiced in the southern part of India, whereas the Ayurveda is more popular in the northern part of India. So maybe at the end of the session, you'll have a very clear idea about what kind of, the few medical practices that has a very deep impact in the chemistry. So before getting into my actual session, let me give you a very brief introduction about Siddha. It's a medical practice of the ancient Tamil civilization. And yes, in the Ayush, it actually represents Siddha system of medicine. And basically, the Siddha system was developed by 18 Siddhas. The Siddhas, this term actually includes the experts in medicine. They are also the experts in other lifestyle practices too. Okay. So, and moreover, there are a lot of similarities between Siddha and Ayurveda, as in both believes in 5 elements and the 3 humor concepts and the 7 tissue concepts and also the 3 bodies doctrine. But there are few things which are really exclusively present in Siddha. One is the Varmam, and of course, alchemy is there in Ayurveda. But you know, when you go into the Siddha literatures, 95% of the Siddha literatures actually speaks about alchemy, and moreover, most of the Ayurvedic alchemy is based on the mercury and its salts, whereas in Siddha you have alchemy that is based on punir, which actually is a salt based alchemy, because that is quite special in Siddha. That's what I mentioned in the last part, punir. Okay, so when you speak about Ayurveda and alchemy, most of you people are aware about the name Nagarjuna, who is a scholar in alchemy. But when it comes to the Siddha part, you have a scholar called Bogar, and what I have mentioned here is like 3 texts that has been available in the name of Bogar. One is Bogar Elayiram, then it is Bogar Karpavidi, and it is Bogar Sarakku Vaipu. So these 3 texts actually speaks very clearly about various chemistry and Vaipu Murai. Vaipu Murai in Tamil actually means synthesizing naturally acquiring substance in an artificial way. For example, if you have a plant and it's not available at that particular season, there are methods to synthesize it in an artificial way. So that is what the Vaipu Murai means. And these books also speaks about astrology, and there are certain things which actually speaks about mechanics too, as in certain instruments which moves on its own. Those kind of instruments are also mentioned in this particular text. So I just want you guys to just remember this name Boger, who is quite equivalent and who has a very great contribution in the field of chemistry from the southern part of India. So in this session, I'm just going to mention only 4 different areas where the chemistry have been employed in a very detailed way. This is the first one. Here, what I have been mentioned here is the 2 different methods of purification of sulfur. So, the sulfur, it's been used in various formulations. So in most of the cases, wherever you use mercury based formulation, it is mandatory to use sulfur. So before using sulfur for the mercury based formulation, it was supposed to be purified. So purification here, it doesn't mean getting a homogeneous form of sulfur. It actually means making it more biocompatible. So what I have mentioned here is like two different methods of purification. The one which is mentioned here in the left, right? This in this method of purification, what we do is like we take a raw sulfur, then we heat it along with butter, and then immediately we quench it in the fresh milk. So what happened is like the color of the sulfur changes from almost like bright yellow to some kind of greenish yellow in the end. So here what exactly is happening is like the sulfur, it actually exists in different allotrophic forms. But the most stable allotrophic form of sulfur is orthorhombic sulfur. That is the crystalline form of sulfur which has been shown in the figure number 1. So that is how it is stable. But when you heat it above 94 degrees, it will melt and it will turn into the monoclinic form of sulfur. But that monoclinic form of sulfur is highly unstable. So because once you again cool it down, it will again revert back to the orthorhombic form of sulfur. But exactly in this purification, what happens? You are adding few herbal ingredients to it. Maybe you can consider it as like an impurities, and these impurities actually helps to remain the sulfur in the same monoclinic form even after you are cooling it down. So the next process, this is also a different type of purification process that has been mentioned. Here what happens is like you are heating the sulfur again and you are quenching it immediately in a mixture which is made of curd and henna leaves. So you are just grinding the henna leaves and you are making into a paste, and you mix it with the curd, and you are quenching the molten sulfur. I mean, you are heating it, you are melting it, and again you are quenching it immediately in this mix. So what happens here is like you get a different kind of sulfur with a different nature. Because this sulfur, what happens is like it will have a elastic property, that is you'll be able to just pull it like a paste, and this remains in the same state for a minimum period of 3 to 4 days. So there is something called plastic sulfur. In modern medicine, the plastic sulfur, how they prepare it is like they'll heat the sulfur around some 96 degrees and they immediately quench it in the cold water. Even in that process, the plastic sulfur will remain in the same state only for a very short duration, maybe some 3 to 5 minutes, not more than that. So after that, it will again revert back to the same orthorhombic form of sulfur, that is the crystalline form of sulfur. So these two methods has been mentioned in the text, and it's also in the usage now for the purification of sulfur. So what I want to mention here is like, why do they just want to make it like a normal form of orthorhombic sulfur into monoclinic and plastic sulfur? There comes the real question. So the main reason is like they are more biocompatible and it can be easily eliminated from our body when you use it in the form of monoclinic sulfur. That has already been communicated in that particular journal too. So here one more thing which I want to convey here is like, though the allotropes of sulfur has been discovered in a very later years, the way they have utilized this sulfur in different forms clearly mention that though the name allotrope has been discovered later, but the actual form of these modifications and everything existed already. So the next topic which I just want to emphasize here is like a same single drug has been used in a different way to treat a different disorders. So here I am just taking an example of Aradoda vasica. The picture of the plant is shown just behind. That has been commonly used drug in almost all the traditional system of medicine. But here you can clearly see that if you take a fresh plant, the fresh plant as such is mainly used to control the bleeding disorder. Either it can be a bleeding via your nose, or it can be via your rectum or any other regions of your body. But whereas if you take the only the juice of the plant, it doesn't work well in the bleeding disorders, but it works well in the respiratory disorder. There is another mode of preparation, that is kashaya. If you prepare a decoction out of it, that is also more works well in the respiratory disorders. And the next form is Manapag. Manapag is like the duration of I mean, the shelf life of the decoction is very short. You can't use it for more than, you can't keep it for more than 8 hours. So, in order to preserve it for a long period, say up to some 3 to 4 months, what they use is like they'll add the palm jaggery to it and make it like a syrup. So, that will have a more shelf life and you can keep it for a period of some 4 to 6 months. So the last one is powder. So here you can clearly see that if you use a fresh plant, indication for the plant is different. Whereas if you can use it as a juice for a different disorder, for decoction you can use it as a different disorder, and as a powder you can use it as a different disorders. Maybe when you just think about what exactly is the chemistry behind it, because okay, the last one is oil. So oil, basically we use this particular same plant for uterine prolapse or the bilateral tubal block. So here you can see, just by using the same compounds with a different formulation, you are treating a different disease. So here you can, when you use a fresh plant as such, you will have all the compounds of that particular plant in it. Either it can be a secondary metabolite or a primary metabolite or whatever it has, along with the fiber and the starch with it. So when you use all the things together, you will have a different effect. Same way, when you prepare a juice, you will remove most of the fiber part of it and of course the part of the starch of it, and a limited quantity of secondary metabolites from that too. So when you remove those kind of secondary metabolites out of it, you will have a different efficacy. And same way, decoction what you do is like you prepare almost like a solvent extraction technique, because water is a strongly polar solvent which will be able to extract all the non-polar, mid-polar and polar compounds into it. So here in decoction you will have most of the water soluble extracts but not the fiber and the starch. And Manapagi is just the preservative form of that. But when you take it for powder, it will be like you are going to dry it. So you lose most of the secondary metabolites of it and you take only the remaining part of it. But when it comes to oil, that's the beauty of it. You are using a highly non-polar solvent in that and you are extracting only the non-polar compounds out of it. So the efficacy of the particular preparations depends on the extracting methods and everything. So this clearly shows that even the ancient system, they had a very clear knowledge about the solvent extraction methods and techniques. And the disease that has been treated were also based on this particular formulations. So then I guess even the chief guest and the speakers, they spoke about this acids that has been employed in the traditional system. Here I'm just going to mention about how the acids has been prepared and handled in Siddha. So the basically the mild acidic substances, they were called pulip. Pulip, how they prepare is like they collect from that, it's a dew that has been collected from the different plants on specific months. Usually, you'll get more dew only on specific durations. Maybe we would say at the beginning of the December to the end of the February. So on those months, they'll keep a cloth on the leaves at night. I mean, maybe say in the evening, and they'll collect the cloth in the morning. So the cloth will be wet with the dew, and they'll collect that particular dew in a separate containers. So if you collect this particular dew from different plants in different months, you'll have different pH on that. And mostly it will be acidic and some will be highly acidic too. So this is the basic method how they initially collected this acids. So in case of acids, how this has been used in preparation of various medications in some instances, and also in treating diseases in few instances. But at present, even at present, this has been in use for preparation of few higher order medicines. So the next form of acid is cyanide. In cyanide, what exactly we do is like we mix some raw materials with a salt. Say it can be a herbal material, or it can even be a earthworm like a living organism, or it can be purely salt alone. So here what we do is like we take a bowl, we mix this herbal materials or an organic or a living organic material or any other salt alone, and we keep it in the keep it exposed to the dew. Only during those 3 to 4 months we'll be able to prepare it, and that should be kept in the dew only at night time. That is, at the daytime it should be kept inside the room, and at the night time it should be kept exposed to the dew. So when you keep on doing it, you can clearly see there is a clear change in pH of that. So at the end of some 45 to 50 days, you will get clearly liquid with a low pH. So there are a lot of formulations based on this cyanide, and I have mentioned few of that. So the next one is like how you prepare using the distillation method. Even in distillation method, there are two forms. The one is teenir. Teenir, the other name is called sattinir, which is like, here what we do is like, we make a fresh juice out of a plant, or a juice, or maybe you can even this make this thinner from any of the living organisms too, like earthworm. So then you distillate it and you collect the distillant product. You make a fresh juice out of a plant, or a juice, or maybe you can even this make this thinner from any of the living organisms too, like earthworm. So then you distillate it and you collect the distillant product. So that we call it as a thinner. But in case of pugainir or travagam, what exactly we do is like, along with the juice, we add various salts. Here the most commonly used salts are mentioned above: potassium nitrate, aluminum sulfate, and punir. Punir, as I have already told, it has not been chemically characterized till date, because the composition varies from place to place where they collect it. So these three are the basic salt that has been used, but there are few other formulation where they have used apart few salts apart from this also. So they just follow the similar distillation setup. So if they use the liquid as such or the juice extract as such, they call it as thinir, and it will be less acidic. Whereas if they add few more salts to it and make it more acidic, and then we call it as a pugainir or travagam. So this is the last kind of inorganic chemistry that has been involved in the Siddha system of medicine. So I hope most of the people over here will be aware of the words Bhasma and Sendura. Similarly, in Siddha we have Parpam and Chanduram. Those are higher order medicines in Siddha. So I'm just mentioning here the mode of preparation of a Parpam or Chanduram. The preparation which I have mentioned here is about the Gandham. In Ayurveda also they have the same counterpart, Gandhaloga, and similarly in Siddha we have Gandham. So what I have did is like, the Gandham is the raw material, and if you just ground it with these four different plant extract and you subject to the calcination. Calcination is actually a thermal process in which and there are different type of calcinations methods where the this ground extract will be exposed to different calcination methods, and the final product will be deemed to be a drug based on some authentication issues. So what I did is like, I just selected one formulation where it includes four different plant extract which ends up in a Gandha Chandura. And similarly, I selected one more different formulation which you call it as a Gandha Parpam. So here the trituration procedures are similar, but only the plant extract that has been added is different. So you have two different formulations where you have almost similar protocol, but there is only the difference in addition of the plant extract. So this is the calcination method what we followed for the Gandha Chanduram and Gandha Parpam here. You will take few cow dung cakes and you fill it in a pit, and then then you place the drug that has been sealed in an earthen pot in the center. Then you again cover it with the cow dung cakes, and the entire setup will be closed in such a way that there will be only small gap for the smoke to escape out, and you burn it from the down. So what here I've shown is like, this graph actually shows the maximum temperature that has been attained during the calcination process, and this was around some 840 to 850. Okay. Uh, this is the authentication method to confirm that the drug is complete. That is, it shouldn't have any glittering, lusterless. I mean, it shouldn't have any glittering particles in the final drug, and when you take the particular drug in your finger, it should go into the creases of your finger, and the final product should float on the surface of the water when you sprinkle it. Of course, when you shake it, it may sink. And the last one is, it shouldn't react with any other substances in the even in case of higher temperatures. So all these tests has been done, and only if the final drug qualifies all these tests, then it can be deemed to be a drug, or else you have to repeat the entire process again. So this is the final conclusion that I draw out of it. What exactly happened is, like, initially the raw gandham, what it had is a layer of silica and a layer of iron oxide. The iron oxide were in three forms. It's in the hematite form, magnetite form, and magamite form. So when you add these four extracts and you subject it to calcination, the final product what it had is, like, the center part, it's the iron oxide, and it's been coated with the silica. So what exactly happening here is like a clear physiochemical modification is happening. Actually, just to reconfirm, again, when you come to the second part, that is the Gandha Parpam, here I am adding a different plant extract, and you get an end product with a different color. When we characterize it, we found that the Gandha Chenduram is actually the iron oxide nanoparticles that has been coated with polysilicates. But the Gandha Parpam is actually the iron oxide nanoparticles that has been coated with the calcium silicates. So both are actually nano substances with a very clear textures. So in order to confirm that, in order to confirm that, we also performed a control experiment. Here what we did is, like, instead of adding these extracts, we just added a plain water, and we did the same experimental procedures. And when we did the same experimental procedure, the same kind of transformation doesn't takes place with water. So, and one more thing what we have to clearly acknowledge here is, like, the maximum temperature that has been noted in during the calcination is not more than 900 degrees. But the melting point of silica or iron oxide, it is more than 1600 degrees. So the exact need for the addition of this plant extract is actually helping them in this transformation in a very low temperature. So, this, okay. So here what I want to conclude here is, like, even there in the physical modifications, you have a very strong chemistry that has been employed in preparation of the uh, Parpam and Chanturam. So these are my concluding remarks. So I would like to state that it's like the ancient chemistry, it has a very strong background within it, and that is the main reason for the development of the modern chemistry now. Okay, thank you.